My name is Lindsay Moore. I'm doing an adult health assessment for my BSN classes at Pensacola State College. Here is my ID. I could not find my school ID. Sorry. This is my patient, Mr. Z. Mr. Z, do I have your consent to assess you, record it, post it online for my teacher to view and grade?
Yes.
Thank you. Mr. Z's health history is that he is a 32-year-old male. He's a mechanic in the Navy. He has no significant health history other than he had his tongue clipped at age 13 from a tongue tie he was born with. He had his wisdom teeth out at age 17, and he's had no other major surgeries since then. Before we did this, started this video, I took Mr. Z's vitals. His radial pulse was 63, strong and steady. His respirations were 16, they were unlabored. His blood pressure sitting down in his right arm was 128/77. His temperature was 98.3. He complains of pain, 2 out of 10, in his left shoulder. He has a chronic shoulder injury that he is seeing his doctor about. His height is 73 inches and his weight is 225 pounds. Using those, I calculated his BMI and we have a 29.7 score. Alright, so I have made sure that I have provided privacy and I have washed my hands, hand hygiene. I'm now wearing gloves. And I'm going to begin the assessment first by looking at Mr. Z's arms and his skin. I note no lesions, no bruises. His skin feels warm to the touch. It has good skin turgor. He's decently hydrated, and his color is normal for his race and age. His appearance is normal for his age and gender also. I'm going to check your skull now and I'm going to touch your around to feel for any lumps and bumps. So Mr. Z has no noticeable swelling, no noticeable lumps that should be there. I'm going to check your sinuses now. Do you have any tenderness?
No.
His hairline is normal for his age and gender. He has male pattern baldness. What can you do? Alright, so I'm going to check your vision. I'd like for you to look straight at me, please. I'm going to check your peripheral vision. So, can you see this?
Yes. 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 Yes.
Thank you. And if I had all the correct tools with me, I would use an otoscope to check for Perla with his pupils to make sure that they equal, round, and reactive. For cranial nerves, and the peripheral vision field was cranial nerve 2. For cranial nerves 3, 4, and 6, I'm going to use the cardinal positions of gaze. So, follow my hand. Thank you. Alright, so I am now going to change my gloves. I'm going to examine your eyes now. The external bits of his eye look symmetrical. I note no swelling, no issues, no lesions, no drainage. His sclera looks pink, his conjunctiva looks pink and moist, and his sclera looks white with a few veins that are noticeable. He says he has seasonal allergies. I would use the otoscope to look in his pupils to verify that there are no shadows. And I would use the ophthalmoscope to you do the red reflex, and that would verify the presence of any cataracts or if he had possible glaucoma. And it would also check the blood vessels a little bit more in depth. I'm going to move on to your ears. I'm going to examine the external structure. I note no swelling, no lesions, no drainage. Everything looks normal as it should for a person of your age and race. I would at this point use the otoscope to look into his inner ear and the ear canal. I would pull his ear up and back and I would look at try to find his eardrum. What I would want to see is something that is shiny and gray, no swelling noted. I'm going to do a whisper test now to check cranial nerve 8. So hold your hand over your ear, please. I'm going to whisper some things, and I would like for you to repeat them back.
Okay. Monday, Tuesday, Wednesday.
Right.
Thursday, Friday, Saturday.
Thank you. At this point, I would also test his hearing and the symmetry of how he hears things with the Weber test and a tuning fork. I do not have one. I would expect him to be able to hear the tuning fork in both ears with no problem. And I would also do the Ryan test, where I touch the tuning fork to the back of his skull, and I would move it forward closer to his ear, and he would let me know when he hears it. But I do not have one. Now I am going to check his nose, his external structures. They look, it looks symmetrical, it looks normal for his race and age. I'm going to ask you to please hold your nostrils while we check for the airflow. Thank you. And now hold the other one and breathe out. Thank you. I would at this point use the otoscope to look into his nose to check for any septum deviation or any swelling or redness. I do not have one, but from what I can see, his nose looks normal, no deviation of his septum. I'm going to look into your mouth and throat. The external mouth looks symmetrical. It looks normal, good color for his age and race. Please open, smile, and show me your teeth. His gums look good, his teeth look good. I don't see any lesions or swelling. I would use a tongue depressor if he had a small mouth to help move his lips and tongue out of the way. I can see into the back of his throat. His tonsils are not swollen. His uvula looks normal, hanging down midline, and is moist. His mucosa is moist and pink. So I would like for you to stick your tongue out, and I would like for you to open your mouth and touch it to the top of your mouth. And then I would like for you to stick your tongue out and say, ah.
Ah.
All right, everything looks wonderful. That would be cranial nerve 12 that I checked with him touching his tongue to the roof of his mouth. And I would also check for a gag reflex, but I don't feel like possibly having him throw up. So is your gag reflex present?
I think so.
Okay. All right, so I'm going to check your trachea. It looks midline, no deviation, no swelling noted. No palpable lymph nodes. I'm going to check his carotid arteries. His carotid pulse is strong and steady. I'm going to use my stethoscope to check for any bruits in his arteries. There's no bruise in his carotid arteries. Everything sounds normal as it should. All right, so for cranial nerve 11, I would like for you to please shrug your shoulders. Good, thank you. I'm going to add resistance. Cranial nerve 11 is intact. All right, so now I'm going to ask to check the range of motion. Could you please look up for me? Look up, down, to the left, to the right. Thank you. While he is sitting up, I see no jugular vein distension. I'm going to go behind you, and I'm going to check your thyroid now. I note no swelling, nothing's palpable. And while I'm behind you, I'm also going to check the symmetry of your chest and your lung expansion, and I'm going to listen to you. While I'm back here, I'm assessing his skin. I note no lesions, no bruises. The color is normal. The temperature is warm. and as expected for a person of his age and race. All right, so can you take some deep breaths in? I'm putting my hands on the back around his scapula, and my thumbs are close together, and when he breathes in and out, my thumbs will symmetrically move. So his chest is symmetrical, and now I'm going to listen to his lungs. Take some deep breaths in and out. Thank you. I'm going to palpate your, lightly palpate your kidneys. Let me know if you have any tenderness.
No.
If you'll please lower your head, I'm going to feel your spine. Spine is straight, symmetrical. Is there any tenderness when I press?
No.
All right, and he has no tenderness, no bruising noted. I'm going to check for tactile firmness. And that is where I place my hands on his back and he says the words 99.
99. 99. 99. 99.
Thank you. I did feel the vibrations in his chest when he said 99, as expected. And now I'm going to check your chest and lungs from the front, and then we're going to do the tactile firmness also.
Okay.
His lungs sound free and clear. We're going to do the 99 test again.
99. 99. 99.
Thank you. All right, so we're going to do the range of motion of your arms now. Can you hold them out for me, please? Can you hold your, do you have any tenderness?
Left shoulder.
His left shoulder, he has reduced range of motion in his left shoulder. Can you raise your hands up, please? Thank you. Out to the side. And then can you put them down, please? Thank you very much. I'm going to check the range of motion of his hands and wrists. Can you hold them out and turn them? Any problems?
No.
Oh, thank you. May I see your arm, please? I'm going to check for lymph nodes in his arm. There's none palpable, which is an expected finding. Thank you. All right, and now I would like for you to please lay down. I'm going to assess your jugular vein again, and then I'm going to listen to your heart. So can you please turn your head to the side? I see no jugular vein distension into this side. Thank you. And now I'm going to listen to his apical pulse, and I'm going to listen to his heart. Before we did this video, I took his apical pulse, and it was 64. I took it for a whole minute. I'm going to listen again. Thank you very much. I heard a normal S1 and S2 sound. His heart sounds great, and this concludes my assessment of my patient, Mr. Z. Thank you very much.